Hello, I'm Dr. David Sachs, pulmonary medicine specialist. Welcome to Dr. Lung. There are three major classifications of medications that can help people safely and effectively stop smoking. The nicotine medications, including in the United States, nicotine patch, nicotine gum, nicotine lozenge, nicotine oral inhaler, and nicotine nasal spray. Then there are two other totally separate non-nicotine classifications of medication. And both of these are tablets. One is bupropion, going by the brand names of either Wellbutrin or Zyban, and the other is varenicline, going with the brand name of Chantix. People have asked me, but isn't Zyban or bupropion or Wellbutrin just for people who are depressed? No. The answer is no. The bupropion molecule is a very unique antidepressant molecule, and back in the 1990s, a very enterprising clinician and researcher at the Loma Linda University School of Medicine, Dr. Linda Ferry, discovered that bupropion was effective in helping people stop smoking, independent of whether or not they were depressed. So in fact, the manufacturer, Burroughs Wellcome at the time, they no longer exist, developed and got approval from the FDA to market and sell the bupropion molecule solely to help people stop smoking, even if they are not depressed at all. So bupropion can be very effective, and it is effective in helping people stop smoking who don't have depression at all. So this may be a very appropriate medication for you. Be sure to talk with your physician to find out. It's available by prescription only. I use it frequently in my practice because it is so effective. Varenicline is a very different molecule. This molecule was developed from the ground up using basic cell receptor principles, the way most new drugs are developed for any indication. Varenicline is extraordinarily effective, and the U.S. Public Health Service has determined that of all medications for single therapy, single drug therapy, it's the single most effective. It doesn't work for everyone. Some people will get side effects. The most common side effect is nausea. For most people, the nausea is mild, but it can be really severe. I've had patients say, but doesn't Chantix cause people to commit suicide? The answer is no. If you look at the data, the suicide rate of everybody in the United States is about 11 suicides per 100,000 people. Separately, if you look at all the data on all the varenicline or Chantix users, and you look at the suicide rate amongst them, it's only 0.6 of one person per 100,000 Chantix user per year. So there's really no way we can say that varenicline causes suicide. The fact of the matter is, there's a huge literature that shows that cigarette smokers who are not even trying to stop smoking have a very high incidence of depression, that in fact they are self-medicating with the nicotine in their cigarettes. And let me mention, by the way, nicotine is one of the most effective antidepressants and anti-anxiety agents that we have, which is why if those are problems you have had when you have tried to stop smoking cold turkey, you definitely need to put yourself in the hands of a healthcare specialist and physician who really knows how to treat tobacco dependence effectively so that your anxiety or your depressive state stay in complete control.